Welcome back to Doc Vat's channel. Here we discuss health-related hot topics
Okay.
based on nice UK guidelines.
Oh, excellent.
Today,
I like it.
we're diving into something that can be a real head-scratcher, especially, I think, for healthcare professionals.
Absolute.
Functional neurological disorder, or FND.
Yeah. It's definitely a condition that needs more awareness. It affects a surprising number of people.
That's what we're hoping to do today
Yeah.
in this deep dive. This is especially relevant for, well, really anybody who's curious about this complex condition, I think, will find it helpful. But in particular, GP trainees, nurses, and medical students, I think, will really enjoy this.
Absolutely. We want to give you a clear understanding of what it is, what causes it, how it shows up, how it's diagnosed, and how to manage it, most importantly. And we're going to bust some myths along the way, too, because there's a lot of misinformation out there.
You're absolutely right about that. I've even heard people dismiss FND as being all in the patient's head, which is not only inaccurate, but also incredibly dismissive of their suffering.
It's a real and debilitating condition, not some figment of the imagination. It has a huge impact on people's lives, and sadly, it's often misunderstood and misdiagnosed.
Okay, so let's start by unpacking this a little bit. What is functional neurological disorder? So I'm imagining our listeners who may not be medical professionals, so let's try to make it as clear as possible for everybody.
Well, think of it this way. Our brains are like incredibly complex computers, right? With FND, the hardware, the physical structure of the brain is fine, but the software, the way the brain processes and sends signals is glitching.
So it's like a software malfunction rather than a hardware problem.
Exactly.
Uh,
And just like a software glitch can cause all sorts of weird things to happen on your computer, FND can cause a wide range of neurological symptoms. So we're talking things like weakness or tremors, problems with vision or hearing, difficulty walking, and even seizures that look a lot like epileptic seizures but aren't.
That sounds incredibly disruptive. You mentioned that FND is often misdiagnosed, so is it actually common?
Well, it's more common than you might think. In
Yeah.
fact, about 6% of all neurology appointments are related to FND. To put it another way, that's nearly 1 out of every 16 people visiting a neurologist.
Wow. I mean, that's a much higher number than I would have guessed.
Right, and those are just the people who get diagnosed.
Yeah.
There are likely many more who are struggling with FND but haven't received an accurate diagnosis. In the UK alone, there are an estimated 8,000 new FND diagnoses every year, and when you consider the folks already living with it, the numbers are even more staggering. Somewhere between 50,000 and 100,000 people.
Wow. Those figures really put it into perspective. Knowing how common it is makes it even more important, I think, to understand, what causes this software glitch, so to speak, in the
Yeah.
brain. Do we have any clear answers?
Well, it'd be great if there was a simple answer, but unfortunately, it's not that straightforward. The exact causes of FND are still a bit of a mystery. However, we have a framework that helps us make sense of it called the biopsychosocial model.
Okay. So I've heard that term before.
Yeah.
But honestly, it always sounds a little jargony to me. So can you break it down for our listeners?
Absolutely. Imagine you're trying to understand why a plant isn't thriving. You wouldn't just look at the plant itself, right? You'd consider the soil it's in, the amount of sunlight it's getting, if it's been watered enough, and maybe even if there are any pests bothering it.
Yeah. You look at the whole environment.
Exactly. The biopsychosocial model is like that. It says that to understand FND, we need to consider the biological factors, like a person's genes and brain chemistry, the psychological factors, like their personality, stress levels, and coping mechanisms, and the social factors, like their relationships, life experiences, and cultural background. It's about acknowledging that all these factors are intertwined and can contribute to the development of FND.
So it's not just one single cause. It's kind of a combination of things that can trigger that software glitch, so to speak.
Precisely. And while we're still unraveling the exact mechanisms, we do know certain risk factors can make someone more likely to develop FND.
Okay. Like what are some of the red flags that might make a healthcare provider think, okay, this could be FND?
Well, one of the most significant risk factors is being female. For some reason, FND affects women about 3 times more often than men.
Interesting. Any other patterns that you've noticed?
Yes. Having a history of anxiety, chronic pain, or a traumatic experience can also increase the risk. It seems there's a strong link to mental health and how we cope with stress.
That makes sense. Our mental and physical well-being are so interconnected.
They really are.
Yeah,
But it's important to remember that these are just risk factors. They don't guarantee someone will develop FND, and many people develop FND without any of these obvious triggers.
that must make it even tougher to diagnose, right?
You're right. There's no blood test or brain scan that can definitively diagnose FND. It often comes down to carefully analyzing the patient's symptoms, physical exam, and medical history. And unfortunately, that often leads to people with FND being misdiagnosed or told that their symptoms are all in their head.
Oh, that's got to be incredibly frustrating, right? For someone who's genuinely suffering. It's
Yeah.
like being gaslit by the medical system.
It really is, and it can delay them getting the right treatment and support.
Hmm.
So it's crucial that healthcare professionals understand the importance of recognizing and validating the lived experience of FND.
Absolutely. Let's talk about what that looks like in practice. So if a GP suspects a patient might have FND, what are some of the key signs that they should be looking for during the examination?
One of the hallmarks of FND is that the symptoms often don't follow the typical patterns you'd expect with a structural neurological problem. For example, someone might complain about weakness in their leg, but then you observe them walking on their tiptoes without any difficulty.
Oh, so it's like their strength kind of comes and goes depending on the situation.
Exactly. That inconsistency is a major red flag.
Okay.
Or they might exhibit what we call giveaway weakness. They'll initially resist your pressure when you're testing their muscle strength, but then suddenly give way, almost like their muscles just switch off.
Huh. It almost sounds like a reflex, but a reflex that doesn't make sense neurologically.
That's a good way to think about it. Another key sign is something called Hoover's sign, which focuses on hip extension. Imagine someone lying on their back and trying to lift one leg. If there's true weakness, they won't be able to do it. But with Hoover's sign, something interesting happens. When they push down with their other leg, they suddenly gain strength in the weak leg.
It's almost like a hidden superpower that only activates under specific conditions. It's amazing how the body can do these things.
It is fascinating.
Yeah.
And these inconsistencies and unusual signs are what help us differentiate FND from other neurological conditions. We're actively looking for these positive signs rather than just ruling out other possibilities.
I love that shift in thinking. It really emphasizes that FND is a real diagnosis with its own unique features.
Exactly. It's a rule-in diagnosis, not a rule-out diagnosis.
Okay. So let's say a GP has identified some of these positive signs and suspects, FND. What happens next?
The next step is referral to a neurologist for a full evaluation.
Right.
The neurologist has specialized expertise in diagnosing and managing FND.
Okay, that makes sense. So once the diagnosis is confirmed, what's the most important thing for the GP to do when the patient returns to their care?
It's all about communication. Explain the diagnosis clearly and reassure the patient that FND is a real condition, the symptoms are genuine, and it's not all in their head.
That validation must be so crucial. It's like you said earlier, no one deserves to feel dismissed or like their suffering isn't real.
Absolutely. And after validating their experience, the next step is to provide them with resources to learn more about FND. Knowledge is power.
Okay. What are some of the best resources out there?
There's some excellent websites and apps that can be incredibly helpful. The FND Guide website, neurosymptoms.org, is a great place to start. They offer in-depth information on different types of FND and how they're managed.
And for our UK listeners, we have FND Action at fnaction.org.uk.
Yes, FND Action is fantastic. They're a UK-based charity that provides support and resources for people with FND and their caregivers. They have online support groups, leaflets explaining FND in plain terms, and even guidance for medical professionals.
Oh, it sounds like a really comprehensive resource.
It is. And another one worth checking out is FND Hope UK. Their website, fndhope.org, is full of helpful information, and they're really active in promoting awareness and supporting research into FND.
So many great organizations just working to shed light on this often misunderstood condition.
And if you're looking for a tool that's right at your fingertips, I highly recommend the MyFND app. It's designed specifically for people with FND, and it allows them to track their symptoms, learn self-management techniques, and even access educational materials that help explain their condition. You can find that at myfnd.co.uk.
Wow, that's quite an arsenal of resources.
Yeah.
I'm sure our listeners will find those incredibly valuable. So once a patient has a better understanding of FND, what does treatment typically involve?
It's important to remember that treating FND is all about rehabilitation, both physical and psychological. We're essentially helping the brain relearn how to function properly.
So going back to that computer analogy, it's like running a defrag program or reinstalling the operating system.
I love that analogy.
Yeah.
And just like you wouldn't expect a computer to fix itself overnight, we need to be patient and persistent with FND treatment. It takes time and effort to rewire those neural pathways.
So what does that rewiring look like in practice? What are some of the specific therapies that might be helpful?
For motor symptoms like weakness or tremors, physiotherapy is often the cornerstone of treatment. It helps to retrain the brain to move in more normal ways and to overcome any functional limitations.
So it's about breaking those faulty movement patterns and establishing new, healthier ones.
Exactly. And it's not just about physical movement. Occupational therapy can be invaluable in helping patients regain the skills they need for daily living, like dressing, cooking, or bathing. And if there are speech or language issues, a speech and language therapist can work with the patient to improve communication.
So a very multidisciplinary approach, addressing all the different ways that FND can impact a person's life.
It is. And we can't forget the psychological component. Remember, we talked earlier about the strong link between FND and mental health challenges like anxiety, depression, and trauma.
Right. Those can play a significant role in both the development and management of FND.
Exactly. So, psychological support, including therapies like cognitive behavioral therapy or CBT, can be incredibly helpful. CBT helps people identify and challenge negative thought patterns and develop more effective coping strategies for dealing with stress and difficult emotions.
And I imagine that's especially helpful for managing functional seizures, since they often seem to be triggered by stress or emotional distress.
You're right. For functional seizures, techniques like sensory grounding can also be very effective. This involves focusing on specific sensory experiences in the present moment, like the feeling of your feet on the floor or the sound of your breath. It helps ground the person and interrupt that cascade of anxiety that can lead to a seizure.
It's all about bringing the person back to the here and now.
Exactly. And it's important to note that the approach to treatment needs to be tailored to the individual's specific needs and symptoms. What works for one person might not work for another.
So it's not a one-size-fits-all approach. What about medication? Is there a magic pill that can fix the software glitch we've been talking about?
Unfortunately, no. There's no quick fix for FND. While medication can be helpful for managing coexisting conditions like anxiety or depression, it doesn't directly address that underlying issue of how the brain is functioning.
So it's more about treating the contributing factors, really, than FND itself.
Exactly. The primary focus is on those rehabilitative therapies we discussed: physiotherapy, occupational therapy, speech and language therapy, and psychological support. They're all about retraining the brain and helping the person regain control over their body and their life.
It sounds like a very empowering approach, giving patients the tools they need to manage their condition.
That's the goal. And that brings us to another important aspect of FND management: follow-up care.
Okay, so what role does follow-up care play, especially in the primary care setting?
Follow-up care is absolutely essential for people with FND. It's not a condition that just goes away overnight. So regular checkups with the GP are crucial, for monitoring symptoms, reinforcing those self-management techniques, and addressing any new challenges that might arise.
So it's about providing that ongoing support, really, and adjusting the treatment plan as needed.
Precisely. And it's important to involve the patient in this process. Working together to create a self-management plan can be really beneficial. It helps the patient feel more in control of their condition and better equipped to handle setbacks or flare-ups.
I like that. It's about empowering patients to be active participants in their own care. What are some of the key things that a GP should focus on during those follow-up appointments?
It's all about understanding the whole picture. Start by asking the patient how they're doing, not just about their symptoms, but about their overall well-being. How is FND impacting their daily life, their work, their relationships, their mental health?
So really getting a sense of the broader impact on their quality of life.
Exactly. And then you can reinforce those self-management techniques that we talked about: stress reduction strategies, relaxation exercises, sensory grounding, anything that helps them regain a sense of control over their symptoms.
And reminding them that they're not alone in this journey.
Absolutely. It's important to remind them that there are resources and support systems available, and they don't have to suffer in silence.
I think you've touched on a really crucial point there. With a condition like FND, which is often so misunderstood, that sense of isolation and feeling like no one believes you can be incredibly damaging.
It can be devastating. That's why validation from healthcare providers is so vital. It can make all the difference in the world.
And I imagine setting realistic goals is also important.
Absolutely. The focus should be on functional improvement, not necessarily on complete symptom resolution. It's about helping the patient live a fulfilling life despite their symptoms.
I love that reframing. Living well with FND rather than getting rid of FND.
It's a much more realistic and empowering perspective, and it emphasizes that having FND doesn't have to define a person's life.
Well, I think we've covered a lot of ground today. We've explored the complexities of FND, debunked some common myths, and hopefully given our listeners a better understanding of how to approach this challenging condition.
I couldn't agree more. And for those who want to delve deeper, we'll be sure to include links to all those valuable resources we discussed in the show notes.
Excellent idea. As we wrap up, I just want to leave our listeners with one final thought. We've talked a lot about the importance of the biopsychosocial model in understanding FND, but I think it's important to remember that this model has relevance beyond just this one condition.
You're right. It really highlights the interconnectedness of our physical health, our mental well-being, and our social environment. And it's a reminder that we can't treat people in isolation. We need to consider the whole person, not just their symptoms.
Exactly. So whether you're a healthcare professional or simply someone who's curious about health and the human body, I encourage you to embrace that biopsychosocial perspective. It's a more holistic and compassionate way to approach health and illness, and it's something we could all benefit from.
Well said. It's about recognizing the complexity of the human experience and appreciating that intricate tapestry that makes us who we are.
And on that note, we'll conclude our deep dive into functional neurological disorder. Thank you so much for joining us. We'll see you next time for another insightful exploration into the world of health and medicine.